It's Monday, and that means it's time for a new episode of Interviewing People, the careercast where you can learn about a variety of careers from people actually doing the work. Today I'll be talking with Rachel Adolph, who once walked these halls but is now a physician's assistant working at the Cleveland Clinic Center for Spine Health. Rachel will be sharing about her path to becoming a PA and much more, so enjoy the show. So today we have Rachel Adolph with us, and she is a physician's assistant at the Center for Spine Health at Cleveland Clinic. And she's going to be talking a little bit about her path to becoming a physician's assistant and what that meant and what that means for her on a daily basis now and so forth. So Rachel, thank you very much for joining us. And I'd love for you to talk a little bit about how you ended up becoming a physician's assistant.
Sure. So I actually, the majority of my life, wanted to be a physical therapist because my dad is a physical therapist. So I was obviously very much surrounded by that growing up. So my plan through high school and even majority of college was physical therapy. So I tried my best to set myself up for that. Starting in college, I was majoring in exercise science and minoring in biology as well as psychology. Up until my junior year, the plan was physical therapy. And then my dad actually mentioned, hey, have you ever considered physician assistant? And I really hadn't heard of it much before. So I decided, hey, why not just shadow a physician assistant, which ultimately is the best way to fully decide what you want to do. You can read all about things, but until you actually put yourself in, that position and get a good idea of what a day in the life of, a PT or a PA or whatever does, then you really don't know, So I shadowed a PA, and within the first hour, I knew that this was a much better fit for myself. The approach to medicine is different. So that's, I think, what really drew me to the profession. So it was my junior year of undergrad that I decided I was going to make the switch. Luckily, because it was still within the healthcare realm, it wasn't too difficult for me to kind of veer directions. I think the biggest difficulty was that I did need to, start switching to a much more chemistry heavy load, which wasn't, in the cards for PT as much. So I was actually playing volleyball in college. And I was going into my, last season, my senior year. And in order for me to apply to PA school, I had to take 5 labs in my fall semester.
Wow.
And that's just not really doable, playing a sport in college, because a lot of times we would be traveling long weekends. So I would usually have to miss classes on Friday a lot of the times. So I felt very passionate about PA, and I really wanted to put myself in the best position to get accepted right out of undergrad. So I actually decided to not play volleyball my senior year so I could really focus on my academics, make sure I, was able to focus as much as I could and put myself in the position to get into PA school right away.
Right.
So I had to, obviously crank up my shadowing for PA. So I had to do that a lot over the summer. And then, I started applying and took 5 labs. I was in a lab Monday, Tuesday, Wednesday, Thursday, Friday of my fall senior year. So it was very difficult, but ultimately so worth it, So I applied and I ended up getting into multiple PA programs, and I am so happy that I made that decision and made sacrifices to pursue PA.
Right. Well, yeah, I know how much you enjoyed sports, and I'm sure that was a very tough decision, but obviously the right one for you long term. So as a physician's assistant, what makes a physician's assistant different from a nurse practitioner, different from a doctor? What are the differences there?
Sure. So as a PA, we're trained in the medical model. So whenever we're talking PA versus nurse practitioner, ultimately we're considered an advanced practitioner. So we are very equivalent on the level of, what we're able to do in the realm of medicine, but our training is slightly different. Nurse practitioner is trained in the nursing model, and we're actually trained in the doctor model. So a lot of what we do in our training is really built around med school. Obviously, it's not as long as medical school. And that's ultimately a lot of the reason why, a lot of my colleagues and I choose PA is because it's much shorter schooling. So, you have to do 4 years of undergrad and then 2 years, it's a master's program. So 2 years after. So it's a lot of information within 2 years. In the program I went to Baldwin Wallace in Buren, Ohio, and they have a condensed program. So instead of kind of the normal 28-month program, theirs was 24. So it's a lot of information in a short period of time. But it really does, embody, a quick path, kind of through medical school. So our first year is all didactic. So it's all kind of learning about everything. Our medical director is a physician, and he said it's about 80% of medical school jammed into 2 years. So it's very, very rigorous. And then our second year is all clinicals. We had 11 different clinicals, which was nice because you got a taste of every facet of medicine. So you'd go through that and then you'd graduate. But, I think the best thing about being a PA is that you're able to diagnose, treat, prescribe. So you really get, everything within medicine. You see a patient and you're able to kind of, come up with the differential diagnoses of what could be going on. You have the tools in your toolbox to order whatever imaging or lab work, that needs to be done to figure out what's going on. And then you get to treat the patient too. So it is, a great profession to really get a quick way into the healthcare field, be trained, to the extent of the medical practice, and just love what you do, especially if you want to work in healthcare.
Right. Yeah, it sounds like a great option because I have to imagine that medical school seems very imposing to a lot of people and obviously does take a lot of time, and this gets you right in there pretty quickly. Now, I noticed that you are a certified physician's assistant. The whole idea of being certified, is that something that you had to have, or is that something that goes beyond just being a physician's assistant?
Yeah, so you pretty much for any job, you have to be certified. So the certification just comes, so the C on the end of your name just comes when you pass your boards. So we had to pass our medical boards. And actually, PA is one of the only professions that you have to actually retest every 10 years. So I'm 4 years into being a PA. So I will have to take our exam again in 6 years. So it's a little daunting, but it does just encourage you to keep up with all the literature. Another great thing that I love about being a PA, and this is even compared to becoming a doctor, is as a doctor, you have to choose your specialty. You really have to, you only get to do kind of one thing. Whereas PA, I work in spine right now and I love it. And I love the surgeon that I work with, but I also work at an urgent care too. So I'm able to do, all these things. In 5 years, I could decide I wanted to, just be orthopedics or just be dermatology, so I love the vast opportunities that you have to be able to switch because we're trained so generally, so that to me was one of the most attractive things about becoming a PA.
Good. So you talked a little bit about working at the spine center.
Mm.
Is that a large office? Is that a really small office? You said you worked with a specific surgeon. What's the size we're looking at with that?
Yeah. So because I work at the Cleveland Clinic, everything's large because it's such a large, obviously, medical facility. But the Center for Spine Health is actually a subdivision of the Neurological Institute at the Cleveland Clinic. So we probably have about 300 employees within the Center for Spine Health, and there's a lot of different realms kind of within spine. So we have medical spine, surgical spine, and then interventional spine. So the way I work within the spine center is I'm my own provider. So I have a lot of autonomy and I see my own medical spine patients. So what that means is, if somebody has acute back pain or some form of an acute problem where it hasn't been going on that long, or even a chronic problem and they just haven't done any kind of intervention, they'll come see me for an evaluation and we'll kind of set up a treatment plan. Okay. I also work directly with a neurosurgeon at main campus. So he does, a lot of spine surgery. So I support his practice. So I handle, his outpatient service. So any of our post-op patients have problems, I manage them. I see new patients for him. I send patients to him. So that's kind of how I work directly with the surgeon, but then also, have my own patients as well.
Right. So a lot of teamwork with a lot of other people, but also the autonomy of being on your own. So thinking back to when you were at Mount Union and playing volleyball, what was that like to balance school and sports? And what kind of experience was that for you?
Yeah, it was very challenging, especially being in a science-based major. It's challenging because, again, it is you have to do a lot of labs, a lot of times there are, a lot of exams and different things. So it took a lot of focus because when you play a sport in college, your season doesn't really ever end. You'll play your formal season, but then, we might have a few weeks off, but you start right back up again with training. And we even had a spring season that required a lot of time and effort too. So it really took a lot of organization, I would say. Luckily, that's kind of what I had growing up too, at Van Buren. I was always involved in a lot of sports. And the classes, that I took at Van Buren were challenging as well. So I feel like I set myself up to do well, in college to be able to handle that. But I would be lying if I would say it was easy all the time. It
Right.
Definitely, took some times where I had to decide I wasn't going to go hang out with my friends sometimes on the weekends because, I had to stay in and get an assignment done or study for an exam or things like that. So it definitely took, I would say, a lot of organization, a lot of determination. You have to bring your books on the bus. You just have to be really organized, I would say, to be able to keep everything within front of you,
Right.
to get it done.
Right. Yeah. And obviously, again, good practice for your career of getting organized and so forth. As you think about volleyball and college and your work, I'm sure you've built a lot of relationships with a lot of different people.
Mm-hmm.
Is there any relationship that you can reflect on and say, wow, that one has really helped me, and whether it was one back in college or whether it's one that in your current profession? So what's a relationship that's been important to you? And then overall, how have relationships played a role in your career path?
So I would say, one relationship that will always stick with me is my clinical advisor during PA school. Will be a relationship that I'll always really cherish. It was so nice because, you think you think you are kind of really on top of academics, especially if you do well in high school and then you do well in undergrad, and then you just assume that it's going to be the same when you're in a graduate program. But it is so different. And I went through all straight. So I didn't have any time off. So I graduated from Mount Union on a Saturday and started PA school Monday.
Oh,
so I didn't ever really get a break, to kind of enjoy that time with my friends or family. And it was just right into something that was so rigorous. And I don't think I was really expecting it. So I really struggled my first semester of PA school. I think I was 22 years old. So all my friends were doing all these fun things. I just remember crying because my friends were going to like a concert or something and I couldn't go because I was studying,
right,
and
right.
that's hard when you're that age and you want to do all these things, but you can't, so she really helped me through, figuring out what I needed to do to be successful in PA school. And I will honestly say I had to make some changes compared to the way I studied in high school, I studied in undergrad. It's different. So she really helped me along during PA school. She challenged me. She always supported me. And then she was a PA as well. So she was also a great role model. She was working in education in our program, but also still working as a PA. So she shed so much knowledge in, clinical advice, but also life advice that I will always cherish because that was a huge help for me to really kind of figure it out
Right.
in PA school. When you're in a rigorous grad program like that, they're not going to necessarily hold your hand, because if you're not keeping up, you're going to get put on probation or, you're going to get kicked out of the program. So, we weren't able to dip or have any more than 1 C in a semester, or you got put on probation. So it was very, very challenging, and they really kind of kept on top of their students, though. They did a great job, being able to sit down with everybody that may have been struggling or doing great and just kind of help refocus moving forward. And that's what she did for me. So I will always, always appreciate that relationship moving forward.
Good. Yeah. Sounds like she was a huge help. And obviously I want my doctors to have gone through rigorous training. So that's a good thing. And, I'm glad that they had people there to support you and so forth. So if there was a high school student today considering becoming a PA, is there any advice you would give to that student?
Yeah. I think, the biggest thing is if there's something you want to do, whether it's PA or anything else, you just need to go for it and really prepare yourself for it as well. Nowadays, just kind of, getting by with wanting to do something isn't necessarily, going to get you there. You have to kind of go above and beyond to really show that, hey, I've been passionate about this for, a little while, or for me, my passion is new for this, but this is what I've done to get myself here, and I think that's what ultimately will make you attractive. You have to show that, hey, I want to do this, and this is what I'm going to do moving forward to get myself there. I think shadowing is one of the best things that I did to really figure out what I wanted to do. And then on top of that, especially when you start interviews or, applying or anything like that, a lot of schools just want to know who you are, so making sure your personality shines through, show them that you are a hard worker and, what kinds of things you can bring to the program, because ultimately they want to, have somebody that is smart, and is going to be a good practitioner. But also too, we're especially working in healthcare, you need to be able to develop great rapport with patients. You need to develop trust with patients. So being able to interact as well is a big part of, being in the healthcare field as well. You could be really smart, but if you're unable to establish that trust and bond with your patients, then there might be a little, lacking in the care that you can provide. So I think ultimately, if you want to do something, go for it. It's going to be hard. Anything worth doing is hard and challenging. But ultimately, it's always worth it in the end.
Good. Yeah. And that's a perfect segue into, I've got just a couple fun questions for you. So
Sure.
living in Cleveland, I'm pretty sure you probably grew up a Steelers fan.
Yes.
But Cavs, Indians, Browns, which one of those is your favorite to follow now that you live in Cleveland?
Yes. I would say the Indians. Cleveland is awesome. And I think that's why I never left. I went to Mount Union, which was like Canton area, but then going to PA school in Berea, it's like 15 minutes outside of Cleveland. And, growing up in Findlay, Findlay is awesome right now. Downtown Findlay is like so cute. So I love going back home. But, it's just not getting that city feel, and Cleveland's just so fun being on the water and having 3 sports teams. So, when the Cavs won, that was fun. But going to an Indians game, there's nothing better. On a beautiful day, the sun shining, you can kind of walk around, and then, downtown afterwards. It's also fun. I've lived 5 miles outside of downtown since 2016, and it is awesome. I love it.
I was going to say, that's my dream, to live that close that I could go to an Indians game and then be home within 15, 20 minutes. That's
Yep.
my dream. So,
Yep, absolutely.
So what would you say is the biggest difference between living in Northeast Ohio and Northwest Ohio?
This one's easy, and it's also sports related. Everybody here is obsessed with every sports team. And I think that really shocked me when I moved out this way. I was just kind of like, oh my gosh, these people are so obsessed with the Cavs and so obsessed with the Browns and so obsessed with the Indians. Whereas in Findlay, it's just not like that, because we're, 2 hours away from the Cincinnati Reds. We're 2 hours away from Detroit Tigers, and then also the Indians. So I feel like there's so many people that like so many different sports teams. And then coming to Cleveland, and I would get like booed in the Muni lot downtown, like for a Browns game when we were playing the Steelers. Because of course I would wear my Steelers stuff,
Right.
but I grew up a Steelers fan. I'm not trying to, cause a ruckus. I'm just supporting my team. But people are diehards out here. And that would be one of the biggest things. But also too, being on the water. And where I live right now, I'm 1 mile from a park on the water, and being able to just walk down the road and walk in the park with my dog is like amazing. The best Saturday morning ever, walking around Lake Erie. So that's also really cool. But the winters are a lot worse here too.
Yeah, that's true. There's definitely a trade-off there.
Yeah, for sure.
Very cool. As we wrap up, what's one aspect of your career that maybe people aren't aware of because it's not, really well known about the healthcare field?
Absolutely. I think from my experience, I think what people don't necessarily realize is everything that a PA can do. I think some people, and even some of my current patients now, I'll have an office visit with them, and at the end, they'll kind of be like, wow, I didn't know that you could do all of this. And I don't get offended by that at all. It's all about education. And, in order for the PA career to continue to grow, there needs to be a better understanding of what we can do and how confidently we can diagnose and treat and manage our patients. So I think ultimately just some people aren't as aware of everything that we can do and offer to a patient. I think one of the best things, particularly during COVID, we were so kind of limited on what we could do, especially at the Cleveland Clinic and especially within my department in regards to surgeries, that I really had to, kind of start seeing a lot more patients along with my surgeon. So a lot of the management was very much shared in the sense that, hey, this is what you need done, but we need to manage you in the meantime because we're not able to do surgeries right now. A lot of our visits turned into Zoom or virtual.
Right.
So we started doing a lot of virtual visits. So we were managing people virtually. So there were a lot of changes, and I think it was positive for the PA career, just in general in the profession, because people were really able to see, what we can offer to healthcare and how we can work alongside every other facet of medicine. That's been one of my favorite things, is just ultimately showing my patients, hey, you can feel confident in what I'm going to do for you.
Right.
But also know too, I work personally with the surgeon. So if there's anything I can't do for you, I can run it by him too,
Yep. Good. So the last question, what do you know now as a professional that you wish you had known when you were in high school?
I think one of the more difficult things for me was just, you always want to hurry up and grow up, I think, so I was always really excited for that next step. And I personally like change. So I was always really excited to move to that next step and move to that next step and move to that next step. So, you always rush through it, I think, to get to that next point. But sometimes you really just need to enjoy where you're at and try to, get everything you can out of every situation. I think one of the best examples of that is when I was in PA school and we were in our clinical year, there were some clinicals that you just didn't like, which was great. That's the reason why you do clinicals,
Right.
You just don't want to jump into a specialty or a certain part of medicine that you're going to hate. So that was a really great thing about, doing those clinicals. But I really tried to remind myself during those clinicals that I didn't necessarily love, that there was still something that I can learn out of this, or there's something I can learn from my preceptor during that time. So there would be some clinicals where I knew I didn't love that area of medicine, but I had an amazing preceptor who was a PA or a physician who taught me so much about life or the PA career. So I think ultimately I would just say, try to learn as much as you can from every single step in life, because it's only going to help you moving forward. And, I had to even try to remind myself of that growing up, because it's easy not to, because you're just excited to get to that next thing.
Right. Well, that's perfect. So Rachel, I really appreciate it. I wish you luck in your future career endeavors. And hopefully I'll never have to visit you at the spine center. Hopefully my back holds up for many more years, but thank you very much for all of this. If anyone wanted to reach out to you to get more information, obviously I have your LinkedIn information. Is there any other way they might do that?
Yeah, absolutely. If anybody wanted to reach out to me, feel free to obviously reach out to me on LinkedIn, or via my email. My email is racheladolph@gmail.com. And I would be happy to, answer any questions that anyone had in regards to becoming a PA, or even, if you're trying to decide what you want to do.
Perfect. Well, thank you very much, and good luck as you go on as a physician's assistant.
Thank you so much. I appreciate it.
Thank you for watching this interview with Rachel Adolph, and to be sure you don't miss upcoming interviews, please click subscribe so you'll know when the next episode is released. Thank you for watching, and as always, remember that the best part about Mondays is interviewing people.